Now, what happens if you're not happy with a surgery or a certain procedure? And let's say, for example, you had your knee operated on, and instead of getting better, it's not healing. In fact, it's worse than before the operation, and you're upset. A lot of times, patients and/or families will seek out the care of a second physician. And part of that, seeking out process, if you will be talking to this second doctor or this new doctor and trying to get the second doctor to pass judgment on the care provided by the first doctor, including trying to get that second doctor to say that the first doctor screwed up, it must be an error, and yeah, you should get a lawyer and file a lawsuit. And again, I'm the guy that lost a brother to medical errors. My family's been through medical malpractice twice, or been touched by med mal twice. But I work with doctors and nurses professionally in this disclosure stuff, and I got to tell you, folks, trying to get a second doctor to pass judgment on the care provided by a first doctor or a doctor that's upstream is simply not fair, nor is it ethical. It's simply not the right thing to do. That second doctor is in no position to pass judgment on the care provided by his or her colleague. They were not involved in the procedure. They don't know what informed consent looked like. They don't know how compliant or not compliant you were or are as a patient. They have no idea. What that second doctor should be focused on exclusively is your care going forward and how they may be able to help you going forward. We tell doctors that are in this position, because it's a difficult position for doctors when patients and families do this to them. Try to get them to say a colleague committed malpractice. We tell them to be empathetic with you, say sorry that you're not happy, perhaps give you some questions to go back to that first doctor with, but very quickly try to transition the conversation to what they can do for you going forward medically. If you have a complaint with a surgery or procedure, some sort of operation, and you've lost faith in that first doctor, it's absolutely fine to go find care from another physician. It's absolutely right. But if you have a complaint with that care provided by the first doctor, you need to be talking to that first doctor. You need to be going back to that first doctor, and again, treating it like the customer service complaint process we've talked about in these videos and talk about in the ebook. You need to go back to that doctor and ask questions and see what they say or see what they don't say, and take it from there.